Prosthodontics is a specialty that I fall in love with, and I had to do 3 years master degree program in Texas for that. And what they teach you as a prosthodontist to do, you become the specialist for the complex cases that need full mouth rehab or more comprehensive work that kind of put the whole thing together. As we know, everyone needs a dentist, and dentists can do a fill, a crown here, or maybe some hygienists can do the cleaning or what you call scaling, root planing. Nevertheless, these are the basic bread and butter for general dentists. Some cases gets to be a little more complex than just a crown or just a fill. Therefore, they look for specialists, and that specialist will be the prosthodontist, the one who create teeth in a form that gives you the aesthetic, and that form gives you the function that gives you the chewing and ability to eat. That's why I call my company implantasmile.com, because I want to implant a smile on everybody's face. The ones that comes in for me for just cleaning, or the other one that come in that I can't chew, I can't eat, I can't smile, I'm down the bottom, bring me back to life. This is my job. I get excited, as you can see. I love what I do, and I put all my energy for the patient's sake. Now, I understand a lot of dentists too do the best for their patients, and many of them go beyond that. For the things that they can do an excellent job, they kind of pose and say, you know what, I can do that job, but may not be the perfect job. I got this specialist for you. And that's when they come our way. Cases sometimes in dentistry could be complex, and some of you can witness that. Say, you know, I can't chew, I can't eat, they made me dentures, they flop, they move, they're not comfortable, I'm afraid to talk because that thing can really come out. I don't feel safe to eat with them because, you know, they move and they hurt my gum. All these have a solution. Today, dental implant give me the pleasure to enjoy dentistry. I'm one of those people that have been practicing dentistry for 30 years plus, and I've been through the time where the limited resources we had, compared to today, we are in much better shape. Therefore, my promise for everybody, I don't want people to suffer from lack of food, lack of nutrition. Reason why being a dentist, we all thrive towards the goal, which is healthy mouth lead to healthy body. And that's proved to be, let me repeat that, healthy mouth lead to healthy body. And that's what made us successful in making people live longer, along with our fellow doctors, with the important advancement in medicine. Between this and that, people live longer. And if you live longer and you're not enjoying food and you're not enjoying your smile and life, so what's the purpose of living? So there are solutions for the ones that they say, well, I spend a lot of money on my teeth, but I end up with dentures. Yes, true. Sometimes, especially with people that have gum disease that may not be controlled well, or maybe they did not really work hard towards maintaining those teeth, it might be hard to keep those teeth. And sometimes, to be honest with you, it's better off, get rid of those teeth, get a solid foundation. Teeth, they are not fixed in your jaw. They can move, and that's how orthodontists move teeth. Implants, they do not move. Once they integrated, they are solid foundation. The ability to chew on implant is much, much stronger than your natural teeth. Don't misunderstand me. That doesn't mean take out all your teeth for everybody. That's not true. Implants are good overall. Nevertheless, they're not easy. They're not simple. You might be a patient for implant, but you may not be a patient for implant. Therefore, there is a good comprehensive exam and evaluation that needs to be done, whether by your general dentist or by your specialist, to determine the difficulty in your case. Not every implant case is an implant case. Some people may not be candidate for implant. Very important, the two areas of knowledge in the field of dentistry. The first is the health of that person. That's in general, the body. The second is the local area. Now, this area here, teeth are smaller and the bone is thinner. Teeth in the back are bigger. and the bone is wider. Therefore, the chances of putting implant on the back is probably a lot easier than the front teeth. Common sense. Some people lose teeth, and when you lose a tooth, whether you are at your general dentist office or your specialist office, there is a procedure that needs to be added, which is called bone grafting. It's intended to maintain the site, to maintain the bone, because the bone is held by the presence of the tooth. Once we extract the tooth, that bone disappears and goes into atrophy. And when that happens, it'll minimize the chance for us of the ability to place implant because there's not enough strong foundation. Therefore, it's very tricky in the implant dentistry how to approach from day one when you are on the verge to lose the tooth. Decisions are very, very crucial. If you missed the boat, you took out the tooth, you did not preserve the socket, you come back later to do the implant, you find no bone, then you have to go through grafting, which is sometimes could be challenged. Sometimes there are limitations of how much you can graft. Then you are really going from a disadvantage, trying to kind of get to a place where I can have the implant. Therefore, every time make a decision of any taking teeth out, the thought has to be, what's next to be before I lose the tooth? Prepare me, doctor, because I want to have a replacement. And teeth are like dominoes. You start losing teeth, then the function change, then the other teeth they're gonna have to pick up, and then guess what? Other teeth start to shake. Why? Because they overloaded. So look at this whole scenario I'm talking about here. You can tell how complex is dental implant. And I'm not saying everybody or every dentist should not do a dental implant. I'm not saying that. There are certain cases that are pretty straightforward that I think your general dentist is excellent and capable of handling that. Now, once the general dentist finds that it goes beyond certain challenge, then I think that's the time to call the specialist. And we'll be always happy to help you.